Senator from Arizona.
I rise to speak today about legislation I'm introducing, the Health Savings Account Expansion Act. Now, earlier this month, individuals across the country were again faced with fewer choices and increased costs when purchasing health insurance coverage. Now, unfortunately, this has been a common occurrence since the Affordable Care Act's inception, but no state, I can tell you, is feeling the pinch more than my state of Arizona. Prior to the flawed rollout of the exchanges in 2013, Arizona had 24 health insurance companies offering plans in the individual market. 24. But just last year, residents in Arizona's most populous county, Maricopa, where I live, had only 8 private providers to choose from on the exchange. So from 24 to 8. And then, if that wasn't bad enough, a few months ago, individuals all across Arizona received notification that their insurance plans were no longer being offered, despite the current administration's hollow promise that they could keep their plans. Now, nearly stripped of their preferred health insurance, residents of 14 of 15 Arizona counties, 14 out of 15 counties logged on into the Obamacare exchanges to shop for new plans, only to discover that instead of the vibrant marketplace that they used to have, they were left with only one insurer to choose from. So from 24 to 8 to 1 for 14 of Arizona's 15 counties. So when I hear today my friends on the other side of the aisle talking about preserving this wonderful program, I'm saying, what state of denial do you live in? Because it's certainly not working in Arizona. In fact, Pinal County in Arizona briefly held the unfortunate distinction as the only county in America without a single insurer willing to offer plans on its exchange. Not a single one. Fortunately, a few months later, one stepped in. Just one. Of the plans that were ultimately made available to Arizonans on the exchange, the average policy came with a premium hike of nearly 50%. Average of nearly 15%. With only one game in town, there was no shopping around for a better deal. To help put this in perspective, I'd like to compare the average cost of health care coverage in Arizona to one of the most important purchases a family will ever make, and that's a home. Throughout most counties in Arizona, it's now cheaper to put a roof over your family's head than it is to pay your monthly health insurance premium under Obamacare. Let me say that again. Throughout most counties in Arizona, it's now cheaper to put a roof over your family's head than it is to pay your monthly health insurance premium under Obamacare. This card will show you, this is for Maricopa County. It's the county in which I live. It includes Phoenix. Homeowners can expect to pay nearly $500 more per month on their health insurance than they do on their house. $500 more on their health insurance than they do on their house. This is for the Obamacare Silver Plan premium. This is a family age 40 with 2 children. So that's about the median, and this is the median mortgage payment. So Maricopa County, $500 more. Let's see the visual for Pima County. Pima County is home to Tucson. Health insurance premiums ran an average family $100 more per month than their mortgage. So in Pima County, you're still paying more. $100 more for your health insurance premium than you are for your mortgage. Then there's Pinal County, the 3rd largest in Arizona. According to Arizona's Department of Insurance, the average premium for a silver plan in Pinal County for the average family of 4 is over $1,700. That's double the median monthly mortgage payment for the same county. So if you live in Pinal County, Arizona, you're paying twice as much for your health insurance premium. And keep in mind, we're talking about the premium, to say nothing of what happens when you get to the hospital or to your doctor and you have to pay deductibles that are through the roof or co-pays. that people have never experienced before. So when they utilize that coverage that they've paid for with their premium, they realize that they can't afford that either. This situation isn't unique to these counties, the most populous in Arizona. In all of Arizona's counties, premiums for a family of 4 dramatically exceed the median monthly mortgage. In all 15 of Arizona's counties. It is unacceptable for the federal government to force families to expend upwards of $1,700 per month of their hard-earned income on a substandard product without options or choices, only to then slap them with the draconian penalty that they simply can't afford to pay for an untenable law. Arizona is, without a doubt, ground zero for the structural failures that are plaguing insurance markets around the country. Insurance exchanges are on the verge of collapsing. Premiums, deductibles, and out-of-pocket expenses are skyrocketing, and our healthcare system is in desperate need of reform. That's why I stand here today to introduce the Health Savings Account Expansion Act. The Health Savings Account Expansion Act goes a long way toward reforming our healthcare system by putting consumers back in charge of their own health care. The bill provides individuals and families with the freedom to choose their health care, the health care that best meets their needs, and allows them to use their health savings accounts on medical products and services that they value the most. HSAs give consumers greater control over their health care dollars by providing them with tax-advantaged savings for these options for their medical expenses. This means that the dollars they work so hard to save can grow over time, tax-free, and can be withdrawn tax-free for qualified medical expenses. The HSA Expansion Act strengthens this important tool by nearly tripling the arbitrarily low contribution limits, thus allowing for greater tax equity and more universal participation in HSAs. The bill would then allow individuals to use these expanded HSAs to help cover the costs of their monthly health insurance premiums. This is a critically important feature, particularly for middle-class families whose incomes fall slightly above the qualified threshold for subsidies, but whose health insurance has become unaffordable. You know, in Arizona, I like to go to the gym in the morning, and I like to get on an exercise bike, and by that bike is kind of a hall where people will walk by, and inevitably, in the morning, sometimes I'll have a lineup of people who will stand to tell me their Obamacare horror stories, how much their premiums have gone up, that they no longer have any options, or that they've had to pay the penalty, or that when they go to utilize their care, they simply can't afford the co-pays and deductibles. I can tell you, it is sobering to hear these stories again and again and again. In addition to further incentivizing prudent savings for health expenses, this legislation also repeals existing restrictions that are put in place by Obamacare on over-the-counter medications, while also reducing the penalty for withdrawing HSA funds for non-qualified purchases. Now, these reforms will help streamline HSAs while also making them more user-friendly for consumers. Mr. President, Arizonans are struggling. They're struggling under the weight of a bureaucracy that is complicating their health care decisions, which are some of the most personal and important decisions that individuals make for themselves and their families. If we hope to lift the burden off the back of our constituents, we have to recognize that the key to reforming our health care system is not more government intervention. Rather, it's allowing individuals the freedom to take back control of their health care and incentivizing prudent decision-making. As the Senate looks to repeal this disastrous law and replace it with real reforms that will successfully lower health care costs and improve choice, I look forward to working with my colleagues and ensure that this legislation is included in those negotiations. With that, Mr. President, I yield back